This is Dr. Christopher Sendy with Nova Health Recovery Ketamine Infusion Center in Alexandria, Virginia. And I'm going to discuss how a therapist can integrate ketamine-assisted psychotherapy immediately to improve your client's outcomes. Now, what are the advantages of ketamine? Ketamine has a long track record of safety and efficacy in both anesthetic use and as well as in the treatment of mood disorders. And we know that ketamine was FDA approved in 1970 for anesthetic use, and it was placed on the World Health Organization's essential medication list in 1985. And there were studies starting in the 1970s using ketamine-assisted therapies with psychotherapy for the treatment of a number of different mood disorders. And this continued all the way through until Berman and his group did an initial IV ketamine session with several treatment-resistant depression patients and demonstrated robust and effective treatment of patients who had failed multiple other therapies in terms of their depression. Now, ketamine is the only medication available that really targets the glutamate system, and glutamate is the key neurotransmitter in the cerebral cortex, and it's involved with both learning and pain, and it's approximately 60% of all the neurotransmitter load in our cortex and in our brain. And it is actually the neurotransmitter that modulates serotonin and dopamine. So when ketamine is used, the end result is basically synapse formation and neuroplasticity. And basically we end up with neural circuitry repair. So ketamine actually sets into a chain reaction after it interacts and antagonizes the NMDA receptor, basically the formation of specific proteins in neurons, and then it allows them to create dendrites that allow them to create new synapses. And that's what we call neuroplasticity, because one of the key features of depression and mood disorders is actually loss of dendritic spines as well as loss of neuroplasticity. Now, ketamine therapy is a rapid and robust treatment for severe depression, and 70% of treatment-resistant patients who have failed multiple other therapies, multiple medications, even ECT and TMS, have a response or remission within days of the initiation of treatment. Generally speaking, for the IV formulations, you're going to get about 6 intravenous infusions over the course of 2 weeks, and that's like a Monday, Wednesday, Friday type of a pattern. And traditional antidepressant therapies can take weeks or months to basically work, if they work at all. So only 1/3 of patients, based on the STAR-D trial, will actually get remission from their first antidepressant. And that may take up to 2 months to happen. And half of those patients actually relapse back to depression within the year. And ketamine therapy responses in depression and mood disorders actually can be prolonged and enhanced by applying psychotherapy. And there's a number of studies demonstrating that psychotherapy, such as cognitive behavioral therapy, actually improves depression, but also can prolong actually ketamine therapy results. And ketamine can be administered in a number of different ways. It has also a short duration of psychedelic effects, so it makes it a very handy tool to really allow a person to have altered states of consciousness so that applied psychotherapy can be utilized. Now, ketamine provides its psychedelic effect with really the ability to produce trance-like states as well as transformative states, providing varying degrees of altered states of consciousness from which a framework of wellness can be constructed. And so at lower doses, we get trance-like states, and at higher doses, we get out-of-body experiences, which we call transformative states. And each of these has its purpose and its use, because what's going on in the brain is that different areas of our brain are interconnecting and exchanging information that allows us to consider new opportunities of learning. And so this is part of where the synesthesia comes from, but the journey itself allows individuals to decrease cognitive rigidity and enhance their psychological flexibility and resilience. And this is a key feature of many patients that have depression and get stuck in therapy, is that they are just cognitively rigid and psychologically inflexible. And so for patients that are stuck in their negative mood states with low self-esteem and negative self-talk, ruminative thoughts, circular thinking, ketamine can actually break the shell of that default mode of thinking so that they can consider these new ideas that we're introducing and new directions, and that there's new opportunities as well. Basically, ketamine can increase motivation, it can increase a sense of reward value and a sense of hope as well. And so the neuroplasticity basically that you get from this treatment makes the mind more malleable. And the neat thing about ketamine is it's available right now legally for use in mental health and addiction disorders. And unlike psilocybin and MDA, which are frequently discussed, those aren't available yet in a legal sense. And also, they each have their different sets of problems because they do work from the serotonin system as opposed to working from the glutamate system. And they are also treatments, not cures. And ketamine is a treatment, not a cure either. So we'll just kind of set that as a groundwork and framework for what ketamine and all these psychedelic therapies are about. The other thing about ketamine is that it's got a low side effect profile. And the main side effects that we see with infusions or shots or whatever it might be is really nausea and dizziness. In particular, people get into nystagmus where their eyes kind of bounce back and forth, and that's what throws them off balance. So we see this in about 5 to 10% of patients. And basically, there can be some slight increase in heart rate and blood pressure that generally doesn't need intervention. And otherwise, then you have the psychedelic effects as well, which some people consider to be a side effect, but the reality is that it's part of the treatment. Now, as far as addiction risk, there is really no true addiction risk. Certainly, ketamine can be abused and misused, and it is in Southeast Asia, usually in the context of parties and with other drugs. But there's no physiological withdrawal state. And in clinical use, there's been no cravings with ketamine use. And it's an extremely safe medication. We actually use it for the treatment of alcohol use disorder, cocaine use disorder. There's even studies of marijuana use as well, and heroin, and a couple of other types of addictions as well, that ketamine is found to be very effective in combination with cognitive behavioral therapy. Now, one thing ketamine does do is it promotes wellness factors, which are not things that we study generally with traditional antidepressants. So people feel less depressed, they feel improved hope, better self-esteem, increased happiness based on the studies. And the treatment can be also intermittent. It doesn't have to be a constant treatment like traditional antidepressants you got to take every day. Whereas ketamine therapy, not so much. The problem with traditional antidepressants are that there's a lot of side effects such as weight gain, anhedonia, and as well as loss of motivation. Anhedonia, of course, being one of the more key things that people see. And the other thing is that traditional antidepressants don't treat brain fog. They don't improve your cognition necessarily, whereas ketamine actually is pro-cognitive. Now, the setting of ketamine use can also be used in a more home-like, non-medicalized situation as it's overall safe. And so this allows us to basically prescribe ketamine in the setting of home use for microdosing as a nasal spray or oral troches. And this is something which can be actually utilized for follow-through therapy in the context of actually psychotherapy, whether it's cognitive behavioral therapy or other types of behavioral therapies as well. Ketamine is extremely versatile and very safe, whether it's used in an office setting or in a home setting. Patients can also develop a better mindset with the comfort and safety of a non-medicalized treatment process. So when they're in a home-like atmosphere, they just feel more comfortable. Lastly, ketamine treats multiple conditions, including anhedonia, major depressive disorder, bipolar depression, anxiety disorders, PTSD, OCD, existential crises, and pain. So how can ketamine therapy be immediately integrated into a therapist's treatments? Well, psychotherapy provides the cornerstone for long-term effectiveness of ketamine therapy. And there's a number of studies that demonstrate that the combination of specific therapies, psychotherapies with ketamine therapy make the ketamine therapy work even better. And ketamine therapy can make the psychotherapy work better for a number of these mood disorders. And so the key roles of the therapist are the preparation of the patient prior to the actual infusion process with goal setting and setting of intentions with expectations of what ketamine treatment can do and can't do. And also this is best done by a trusted therapist prior to the treatment. So the therapists know their patients much better than the person who is administering the ketamine. And so these individuals trust their therapists significantly who know the depth of what they've gone through in their mental health journey. Now, we can start with lower dose infusions of ketamine to provide a window of access into the mind of clients that have been rigidly stuck with certain negative beliefs, behaviors, and ruminative thoughts. And during these low dose infusions, the patient's still able to communicate effectively, but the barriers to conversations are broken down. So they tend to speak more, they have more to say, and they're more willing to talk about things that otherwise have been bothering them. And ketamine therapy with KAP sessions provide an opportunity to gain insight into complex struggles that the individual has had difficulty in processing in their normal states of mind. So the therapist can accompany the client to the treatment session and can help the integration process immediately during the actual infusion session, or even later in the day or the next day by reviewing the thoughts that the individual had during the ketamine session and new attitudes that they might have developed during the treatment process, and allows them to help reprocess their new perspectives and new identity that they're starting to come into. Now, ketamine increases neuroplasticity and learning as well as being pro-cognitive. And the best integration therapy sessions can occur really the following day when the neuroplasticity is enhanced. And ketamine is way out of the system within an hour after the patient leaves, it's gone. So any good things that are happening in that afterglow is due to neuroplasticity and other downwind neurotransmitter changes that ketamine causes. So the brain begins to be more malleable and psychologically flexible and open to new directions. So this makes therapy work better. And home-based ketamine nasal spray and oral troches can also make these therapy sessions better through microdosing, which allows the person to take smaller doses at a time prior to their presentation for a therapy session. And they're not altered, they're basically more open to ideas and new ideas of learning. So ketamine therapy is managed by the physician, the dosing and the administration and the prescription, but the patient could actually use home ketamine to augment their regular cognitive behavioral therapy sessions by basically breaking down the armor that creates this fixed thinking. And so the cognitive rigidity starts to go away and loosen up. And so in effect, the patient would be using ketamine in a prescriptive manner, and he would be using it in the context of further therapy and basically opening up their mind to new learning. So ketamine can be used along with psychotherapy also to treat addictions like alcohol use disorder, opiate use disorder, cocaine use disorder, and marijuana-related issues as well. And there's a number of studies involving each of these. So patients are more open to approaching difficult conversations during these ketamine-assisted psychotherapy sessions, and they're able to develop better strategies for successful coping. And also, ketamine therapy with the psychotherapy helps with negative thoughts and ruminations and self-sabotaging behaviors. And the focus can be more on positive self-concepts and reframing themselves and improving their self-esteem. And ketamine does have evidence that it actually improves wellness factors, including self-esteem and hope. And so goal setting begins to be easier with more positive thinking. And then behavioral activation can then be emphasized as motivation increases and fatigue decreases. It's easier to develop better structured time. And there's more hope established that they're not going crazy or not mentally ill, and rather that actually they're getting better and getting back to their old self. So patients are now more open to new experiences and creative thinking as negative self-talk decreases, and new coping skills again are likely to be incorporated. And this is the role of the therapist, is to help this whole process, where this is where the heavy lifting is. The ketamine's given, but now the heavy lifting is basically incorporating all this new learning that the patient has been having. And so the therapist can create new learning experiences as a result of increased cognitive flexibility brought on by neuroplasticity. So therapy and the ketamine treatments can bring new perspectives to the client and a directed ability to see themselves in new ways. And the clients are better able to put trauma in the past or reprocess it in a way so that there's less self-blame, and that they can move forward with forward thinking and better goal setting so that there's less hyperarousal and intrusive thoughts. So the entire scheme of ketamine-assisted psychotherapy is such we have the preparation sessions, which involves determining if the patient's a candidate for treatment, which anybody with treatment-resistant depression and OCD, PTSD, or existential crisis, bipolar depression, even new onset depression, can benefit from early treatment with ketamine, because we know that mood disorders and depression is neurodegenerative and actually causes cognitive scarring with the loss of verbal ability and also the loss of visuospatial processing. And this should be treated aggressively like an emergency. And that's one of the faults of traditional medications. And so in these preparatory sessions, you would explore goals and reflect on intentions for the sessions, set expectations, and define safety in the process. And of course, this helps set up the mindset of the patient, the set. And then there's the setting with the ketamine dosing. Now, ketamine sessions can be performed IV or intramuscular, but IV is definitely the easier and more effective route, and it's more controllable. And the sessions last about 45 minutes to an hour. The setting is comfortable. Nova Health Recovery, the rooms are more home-like with comfortable chairs, and there's also music that we utilize as well, and also more like a home-like atmosphere that's safe, and it's a very reliably comfortable setting, more like being in your home couch. And this allows the individual to just kind of drift into the ketamine session. And so talk therapy can be done during or immediately after or the next day when the ketamine session is done. And that's when the neuroplasticity is the greatest. And then you have the integration sessions, which is the talk session, as I mentioned, the next day. And that's basically important to improve positive outcomes and supply support and integrate insights the person has had and reinforce the concepts of change that's part of the treatment process. So these sessions basically run like other cognitive behavioral therapies for integration sessions, but basically you can use other forms of behavioral therapy, such as acceptance and commitment therapy and IFS, and for addictions, motivational enhancement therapy or mindfulness-based relapse prevention, which has been utilized for cocaine use disorder with psychotherapy. And so these have been all found to be valuable in application with ketamine therapy and psychotherapy to improve patient outcomes. And the scheduling of these integration sessions are either later in the day after the infusion or the next day. And you can actually have follow-up sessions the day after that as well. So generally, KAP sessions lead to better results and enduring results when you have more frequent ketamine sessions and more frequent psychotherapy sessions. Now, there's variations in the number of integration sessions that follow, but some will do a ketamine session and then 2 integrations. But again, you want to have those integration sessions in a short succession after the initial ketamine session. And so just to recap, the integration session really happens when the person is not receiving ketamine, when their mind is not in an altered state of consciousness. And the purpose of therapy is to allow the person to process their thoughts and feelings that may be evoked during the treatment and then kind of redirect their thinking process. Now, at Nova Health Recovery, we do allow therapists to accompany their clients for lower dose sessions to allow a more open exchange of talk therapy, as individuals are more able to discuss difficult situations, that the mind expansion that they get with ketamine actually produces. This allows for new learning and new directions that the therapy can take, especially in patients that have just been cognitively rigid and stuck in their thinking, that circular thinking that we all know so well. And so the client is best treated by the therapist that they've come to trust, especially for complex PTSD as an example. And so the therapist can help guide the client, as far as meditation and guided imagery and redirect thought processes to more effective ones during the treatment. Sometimes patients, again, are more willing to talk about concepts that they wouldn't have talked about when they have normal states of consciousness. And this opens up new opportunities for basically approaching problems that are deep inside the patient. So it would be the same therapist providing an immediate integration session within the next 24 hours. And depending on the nature of the condition, most will need 4 or more sessions of KAP, ketamine-assisted psychotherapy, with the ketamine and then the follow-up psychotherapy. So sometimes they're twice a week, sometimes they're weekly, and there's really no upper limit of total sessions. But again, revisiting the use of home-based ketamine in microdosing fashion allows for improved cognitive flexibility during therapy sessions. And we've seen this very effectively, and a number of therapists have incorporated this into their practice. So the patients will do IV ketamine therapy sessions and integration sessions, and then they'll follow up with home-based ketamine microdosing. And so generally, the dose would be taken about 30 minutes to an hour before a therapy session. And this allows for increased openness for difficult conversations, as well as the ability to break the shell of learned behaviors that don't serve the patient well, so that they can actually reprocess new information. And really no special training is required, as you're already utilizing the same cognitive behavioral therapy tools, and you're just actually applying it to a more malleable individual in an integration session. So who does ketamine-assisted psychotherapy treat? And is your patient a candidate? Well, any patient is a candidate if they have a mental health disorder, so long as it's not schizophrenia and they don't have medical conditions that would basically require some sort of medical clearance, such as liver failure, kidney failure, a recent heart attack in the past year, a recent stroke in the past year, or if they're on oxygen for COPD, they might need some sort of prior medical authorization. But if somebody has cognitive rigidity in their treatment process, if they have certain personality disorders or psychological inflexibility and they're stuck in therapy, KAP therapy would be excellent for them, as well as treatment-resistant depression and even early depression. And there are studies of utilizing IV ketamine with initiation of traditional antidepressants, and that actually augments those traditional antidepressant effect and their strength. And also patients with anxiety, OCD, PTSD, existential crisis, addiction disorders, anhedonia, and as I mentioned, early depression, because again, depression is neurodegenerative. There's loss of cognition in mood disorders. That's actually scarring individuals' ability to think clearly. They make bad decisions and they have poor insight over time. And again, with the treatment of depression, about a third of patients that basically get better have difficulty going back to work because of brain fog. And then, of course, fatigue and low motivational states as well, which aren't treated by traditional antidepressants, but are addressed with ketamine therapy. And of course, the time frame for traditional antidepressants to work could be weeks to months, whereas ketamine, we're talking hours to days. So basically, the process for KAP therapy is the patient is screened for medical problems, and then we do a screening of the patient with a medical and integration evaluation. We take a look at the patient's mental health journey and also integrative options to evaluate them as well. We determine the dosing and the frequency of the treatment at that particular time based on ideal body weight and the patient's situation. The then preparatory session is the goals and the intentions and expectations are discussed, as well as the medical issues, addictions, obesity, and integrative health options for further treatment. Because again, it's not just depression alone, it's depression with addiction, depression with excessive weight, depression with hair loss, depression with all these problems mixed together, and chronic pain on top of that. And so again, it's not just one single identifiable problem frequently, but rather a mash of different problems that should all be addressed. And basically, if the therapist is with the client during the ketamine session, they can guide the flow of how that session goes. And as patients tend to talk more during the lower dose treatments, this allows basically guided imagery and redirection to be used to help navigate through difficult conversations. And also, the subsequent integration therapy is completed by the therapist in their office the following day. And then we repeat the cycle in variations. And then, of course, we introduce home-based microdosing of ketamine as prescribed after the initial series to help maintain neuroplasticity, mood, and the duration of the response. And again, these can be administered at home prior to their regular therapy sessions by the patient to help in their psychotherapy treatments. Most people will need booster treatments of ketamine over, on a monthly basis or every few weeks. It just depends on the individual. And then, of course, we follow patients up with medically validated scoring systems to measure outcomes like the QID score, PHQ-9, the MADRS score, the Hamilton Depression Rating Scale, and whatever it might be, just to kind of follow patients along. And there's a number of different systems by which we can do that. So if you are looking for more information, certainly you can email us at email@novahealthrecovery.com. And there's a number of other videos as well describing ketamine and how it functions, and as well as ketamine-assisted psychotherapy. The numbers for the office and cell phone are here as well